Good afternoon. Good afternoon. Hello, welcome to everybody on this beautiful sunny afternoon, which I'm sure we're all thrilled about after the last week that we've had. I want to welcome our esteemed guests and thank both Russell and Camera for all of the work they did in helping to prepare for this. And so my task this afternoon is to make sure that everyone knows the bios of the people that are going to be holding this conversation today. So starting off with, like I said, our esteemed guests, we have Kevin Willmott with us this afternoon. And Kevin is an Academy Award winner, the creator of the movie that we asked you all to preview today called From Separate to Equal, the creation of Truman Medical Center. This discussion will discuss the groundbreaking documentary as it relates today in light of the COVID-19 pandemic and historical health inequities that persist in the U.S. Kevin is an Academy Award winner and a Bafta award-winning screenwriter and filmmaker who has written and directed several feature films, including 9th Street, CSA, Confederate States of America, The Only Good Indian, The Battle for Bunker Hill, Destination Planet Negro, and Jayhawkers. He and Spike Lee co-wrote Blackkklansman, which won the Oscar for Best Adapted Screenplay in 2019. He also teamed with Lee again in 2020 to co-write The Five Bloods, which was just selected as the best film of 2020 by the National Board of Review. Wilmott recently completed the critically acclaimed 24th About the Houston Riot of 1917. He's also a playwright and works as an activist for peace and civil rights issues. Kevin is a graduate of Marymount College of Kansas and NYU's Tisch School of Arts. He's a professor in the Film and Media Studies Department at the University of Kansas. If you haven't watched, hopefully you've watched it before this conversation we're having today, but if you haven't had a chance to watch it, it is still on our YouTube channel and you can watch it subsequent to this conversation. And so next I'll introduce Russell Anderson. And Russell is a native of Denver, Colorado, and has lived in the Kansas City metro area since 2006. He's been with Truman Medical Center's behavioral health for the past 4 years and has spent most of that time working on implementation strategies for trauma-informed care and business development projects. Russell recently transitioned to Truman Medical Center's Human Resources Department, working with the newly created Equity, Diversity, and Inclusion Department. He currently serves as the co-chair of the Truman Medical Center's Diversity and Inclusion Council, along with Cameron, who I'll introduce shortly. And Russell received his Bachelor of Arts in Political Science from the University of Missouri, Kansas City, and his Master's in Public Administration from the UMKC Block School of Management. So thank you, Russell, for serving today. And next is Cameron Meany. She serves as the Special Programs Manager for Truman Medical Centers, where she oversees strategic programs and projects within the nursing division. She's committed to addressing socioeconomic healthcare disparities and is committed to Truman Medical Center's mission of providing care to patients regardless of ability to pay. Before coming to Truman Medical Center, Cameron attended the University of Kansas and University of Missouri, Kansas City, where she earned an undergraduate degrees in history and English and graduated from Mid-America Nazarene University with her master's in business administration in 2018. She is a perpetual learner and is preparing to start a doctoral program in public policy within the next year. And as I mentioned earlier, Camera is also co-chair of Truman Medical Center's Diversity and Inclusion Council, who is spearheading this conversation today. So I will turn it over. Thank you.
Thank you, Maria. And a very warm welcome to Kevin. Thank you very much for taking the time to be with us today. And good
to be with you guys.
We are very excited to be discussing this film. Just a little bit of little paperwork kind of rules. I'm going to play a clip of the film. You might want to turn up the volume a little bit. It's just going to be 2 minutes. It's going to be a little bit of the film. We also will have the chat open. If you'd like to shoot questions as we go, please do. We'll be monitoring that. We will have a Q&A portion at the end. If we feel that a question fits into our line of conversation, we'll stop and get it in there. We want this to be kind of an open, just real conversation about kind of what went into the film and how that pertains to who we are today. Cameron, do you have any other thoughts before we get started?
No, let's kick it off.
Okay. Here, we'll start with a screening of the film, a little clip.
Despite the tunnel's negative reputation, its secretive nature also allowed for quiet acts of humanity.
It was a tunnel that led from General Number 1 to General Number 2. We went over, and so when we got there, we sat on one side, and the white nurses sat on the other side of the hall. But some of them took a stand that they weren't going to waste their time teaching two separate classes. I remember specifically we had a woman doctor. Her name was Dr. McGinnis, and she taught pulmonary medicine, I think it was, and taught the nurses. And so she made this declaration that she would teach us all together, or she wouldn't teach at all.
They had better equipment at General Hospital Number 1, and so from time to time, you would have a patient brought from General Hospital Number 2 to doctors who were willing to treat them there at General Hospital Number 1.
I had complications all the time with my pregnancies, and so I always had to go to the OBGYN clinics, and my baby happened to be born I was only 6 months along, and she was 2 pounds and 15 ounces, and she lived for 2.5 days, and she passed. But I had her at General Hospital Number 2, and when she was born, and they took her from me and took her up to General Hospital Number 1, but I did not know that at the time. And so my nurse came into my room, and I was crying, and she said, "Did you get to see your baby?" And I said, "No, I didn't." So she said, "Well, would you like to?" And I said, "Well, how can I? You know, she's gone." She said, "No, they have her in the morgue up at General Number 1, and I will wheel you up there in a wheelchair." And so I said, "Okay." And she went and got a wheelchair and put me in it, and she wheeled me through this tunnel that connected General Number 2 to Number 1 and took me to the morgue. She let me sit there for a while and look at her, and I never got to hold her, but at least I did get to see her.
Thank you. So we'll start off with the questionings. So what experience or information inspired you to make the film?
Well, there's the entryway at Truman has this great display of the history of kind of Truman and Black medicine in Kansas City, and when I saw that, it really struck me, and it reminded me that you know I didn't know much about the history of medicine in Kansas City. And that really, I don't think a lot of people understood kind of what that medicine was segregated, and what that really looked like, and what that really meant, and the repercussions of that. And I think so often people think of segregation as not, you know, they sit at the back of the bus, you know, and they don't understand how thoroughly everything was segregated, and including hospitals, and so that really kind of piqued my interest, really, and in Kansas City, you know, it was uniquely kind of positive and negative because it was woven within so many other elements of the Black community of Kansas City. You know, the Negro League Baseball League was so strong in Kansas City, and kind of grew out of Kansas City, and jazz was woven into it as well, and just really the Black business world of Kansas City was all woven into Black healthcare and General Number 2 and Wheatley Hospital. And so that all just was such a fascinating world to me that I really wanted people to know more about it and wanted to learn more about it myself.
Kevin, one of the interesting things about General Hospital 2, and you alluded to this a little bit in your previous response, was that it gave agency to Black physicians and nurses to essentially practice and have control over day-to-day operations in their own hospital, which was something that was very unique. But also the move to construct General Hospital 2 was highly political. Obviously, there was some the role that the Pendergast machine played in the construction of it. But there's also this, if you take outside of healthcare, there's a socioeconomic standpoint of having Black professionals working in a hospital. Can you speak a little bit more about the political and the socioeconomic impact of General Hospital 2?
Well, yes. I mean, the Pendergast machine was everything. And you couldn't get anything done in Kansas City unless you got it through the Pendergast machine on some level. And I think the Pendergast machine was connected to the jazz world of Kansas City and the underworld that was connected to that. And so I think that had a lot to do with the political maneuvering of it all. And but Kansas City had a strong basis of Black medical professionals. I mean, it had Dr. Unthink had started it, early on, turn of the century, basically, and there was this kind of Black professional class that existed in the area, and General Number, the Black hospitals, private, and then eventually General Number 2, really made that grow. And Black folks in Kansas City did the hard work. That's what we kind of show in the film. They did the hard work of making that real, and without very little city support, and without, these were private hospitals quite often. Wheatley was a private hospital, and there were kind of clinics that were developed, early on. And so, that was they really kind of created the kind of the foundation for the creation of General Number 2. And so when the notion of the Black hospital burned down, this was before General Number 2, and it was in bad shape, and then there was a fire, and so I think there was a political pressure put on the city fathers there, and I think probably because of the Pendergast machine, they probably got some money out of building General Number 2. I'm sure that's the way it works, right? I'm sure they got a cut, as they say back in the days. But it was great because the thing that was so special about General Number 2 was that it was the hospital that really trained Black medical professionals from all over the country. And Black professionals from all over the country were coming to General Number 2 to learn skills. And it was a new building, and it was a modern building, and it was it was something that Blacks around the country did not have. Most of those hospitals were leftover buildings from other hospitals that built new hospitals, and the Black folks got the old hospital. And so this was unique to Kansas City, that it had a new modern hospital. This is 1930s. And it had a new hospital, and that gave Kansas City a lot of weight in terms of Black healthcare and Black kind of professional creation. And so people really had a lot of reasons to come to Kansas City.
I have a follow-up question to that. You see a lot when Black community, communities of color, when they start to prosper, or when good things start to happen, there seems to sometimes be some pushback from the dominant culture. Did you see this during your research for the film? That, I mean, you have a Black community with a brand new hospital. What was the reaction of the white community?
Well, the reality of segregation is, even when you've got a new hospital, like General Number 2 was in the 1930s, and everything is still under equipped, under kind of, everything is still not what it should be. And one of the things that a lot of Black doctors told us was that, this existed on into the 60s, and that white doctors would, well, actually more like the 50s, but white doctors in General Number 1 would go through the tunnel and take whatever supplies they needed from General Number 2. And so, General Number 2 may have gotten certain kind of modern equipment to start with, but that equipment was absconded, and taken over to the people that really wanted it. And that was a problem. That was kind of an ongoing problem that they had. That just to start with, everything was under equipped to start with. And then, when you don't have the kind of authority, power or authority to control your resources, it's you kind of suffer the consequences. And that's kind of what the story of General Number 2 was. I mean, they were constantly having to really fight to kind of hold on to the things that they did have, and then to move forward from that.
So kind of along those lines, so it was an early exercise in health equity before that term was really kind of even coined. I know when we kind of first discussed doing this, we kind of got on a conversation about how important it is to have institutions like TMC in a community, and the idea of a community hospital. In your mind, what sets a community hospital aside from other healthcare providers that you see?
Well, that term community hospital, this is the good and the bad thing about segregation. The good thing about segregation was that it really kind of focused the Black community. I mean, the Black community was focused. They had to really unify to take care of the community. So, all the Black institutions within the city kind of served each other, and the community really kind of prospered from that. One of the big things we heard a lot of people say in the documentary was how, when Black folks got a PhD, they couldn't go to a white institution and teach or be a professional there. So they had to serve the Black institutions. And so you had PhDs, teaching in high school, in Black high schools in Kansas City. And so the benefits of that were kind of realized all through every kind of institution within the community, including the hospital. And so you had kind of the best of the Black community in the hospital there. And that kind of just, and they looked out for each other, and it just kind of raised kind of everybody up, There's a common purpose, a common, what the essence of what community kind of really means. And that was the great thing about it, that there was no kind of, I'm sure you had, the basic, backbiting that goes with any human being, but as a whole, you had a real mission that they were on to serve. And Black people really prospered from that in Kansas City. I mean, that was one of the really great things. The bad thing is that there were these limitations that are put on you through segregation. There's just these walls that you cannot go get past. And one of the big ones was, they could not become, what's the term I'm looking for? They could not become accredited. doctors had a difficult time becoming accredited. And as that became kind of the big standard in healthcare, Black doctors had a really hard time becoming accredited because you had to work with someone who else was accredited to get accreditation for yourself. And those doctors were all white. And so that became a real issue. And that really started to hurt, I think, segregated hospitals.
I think that's a nice segue into this post George Floyd world where we talk a lot about allyship and how do individuals from the dominant culture become allies for people of color as we try to obtain equitable healthcare, but just equality in general. And so I'm interested in those white doctors who were at General Hospital 1 and some of them that seem to advocate for General Hospital 2 and the doctors there. Would you consider them an ally? At least not maybe by our definition of the term now, but an ally then?
Yeah, I mean, you had both. I mean, we have a story in the film about a doctor in the 1930s when General Number 2 was just kind of starting. And he was one of the major kind of white doctors in the city. And he thought Black doctors were just inferior. He thought that Black doctors could not learn to become surgeons. He thought that they were just mentally and intellectually inferior. And he just believed that. And Dr. Unthink and others tried to persuade him to kind of see it another way, and he kind of played them off. And then eventually he had to kind of work with them. And he saw their kind of professionalism and their ability. And you kind of remember, I mean, one of the things that you hear in the documentary is that these doctors had to make cotton candy out of air often. I mean, they had to do amazing things with nothing, And so the fact that these guys and gals could do that and serve the community as well as they could with limited resources. This doctor was eventually kind of, he kind of knew he was wrong and grew to kind of to understand that these Black doctors were as good as he was. And in fact, Dr. Unthink and other doctors were his pallbearers at his funeral. And I mean, so it went completely full circle, and you had other doctors that allowed Black doctors to follow them, some of them posing as janitors, to follow them into, the white hospital so they could look over their shoulder while they perform procedures so they could become, trained to become accredited. And white doctors quite often would not go into the Black hospital. If they did go into the Black hospital, it was through the tunnel. And so it was like you couldn't let people see you going over to the Black hospital. So the tunnel became this poetic, connection to injustice, right? Where, it's under the ground and no one can see you crossing those lines, those racial lines that you're not supposed to cross. And it's an amazing kind of, when you tell people this story, I mean, they just don't believe it because it's so, it's so crazy that there's this tunnel that Black and white folks are going through. And so there was a lot of allies that were created through the tunnel. But there were white doctors that did not want Blacks to become accredited and did not want them to break into new ground. And that was why segregation existed. I mean, it was rare that you had those white doctors that were willing to risk their own positions to do those things. But they did exist. And, that story that we show in the clip you showed, Russell, that of white nurses and white doctors kind of sympathizing with Black patients in general number 2 and kind of breaking the rules or violating the code. So oftentimes these things were so much rules as they were codes, racial codes, that they violated to try to do the right thing for a patient. You know, so that was the weird landscape of all of this. That you had people trying to stop Black doctors and nurses from progressing, and then you had individuals, and I would term it individuals, who would break the code, break the rules, and they had to be careful because the backlash, they would receive a backlash if they were found out, if it was discovered. That's why these Black doctors had to pretend to be janitors, look over their shoulders while these white doctors performed procedures so they could see it, because it all had to be in secret. It all had to be, because, segregation, that's the thing I like to write about, really. Segregation is also kind of is embedded with violence. This violence is just embedded in segregation. And that's an important thing to remember. Even within the hospital setting, these are institutions that are part of what it means to be white in the country, and these are white supremacist institutions, and these things hold the very class of folks that are managing and maintaining these institutions. I mean, these things are monitored and maintained by them, and they maintain the white supremacy of the country at that time. And so if you violated that, you weren't just violating a hospital rule, you were violating the racial code that controlled the nation. And when it was important, like something like healthcare, you ran the risk of really being, of having physical danger. So it was to become an ally. It took a lot to become an ally.
So, Cameron, do you want to continue on this? I think it's a segue into another question that we have.
Yeah, go ahead.
Okay. Well, so you're talking about, we have allyship, kind of in the background, people going out on the limb to do things, great things, and that shouldn't be discounted. Thinking about now with health inequities and COVID and, negative impact of healthcare on the Black community, the perspective of why Black Americans have the feelings they do towards the healthcare setting. Early in the film, we discussed the fear that Blacks had of the healthcare that we had prior to General Hospital number 2. I think the story of somebody being hurt and they were being taken away, then they jumped out of the vehicle, injured, just to avoid going to receive care. How do you think the legacy of distrust towards the medical community has shaped the hesitancy of Black Americans to seek out healthcare, especially given COVID?
Yeah, well, it's really kind of tragic, and the COVID response has really kind of brought it into focus again. Turn of the century, when hospitals are really becoming formalized and created, there was this thing called night doctors, and night doctors was this. It's right out of a horror movie. I've always thought about making this into a horror film, because this was a real thing. And night doctors, this is when cities were first creating kind of public hospitals and real kind of hospitals. Buildings that were designed to be hospitals. And doctors, we're always looking for bodies to be worked on, to learn from, to kind of, and if you could find, someone that was living, even better. And so you had, like, this is like the 90s to 1910, something like that. And there's this thing called night doctors. And night doctors in big cities were these guys who roamed around at night, grabbed African Americans off the street, And the legend was that they were taken to hospitals and experimented on. And that's why the guy jumps out of the ambulance, because he's that afraid of going to the hospital, because hospitals become known as places where Black people are going to be experimented on because of night doctors. And it was true. I mean, obviously, how much it happened, no one seems to be able to say exactly, because obviously this was all, underhanded kind of stuff. But it did exist, and it left a mark on the Black community, a paranoia really about hospitals. And so it started early on. It started at the turn of the century. And then obviously the Tuskegee experiment, brings it into almost like the modern world, really. Well, my father was I had older parents. My father was born in 1898, and he was 60 when I was born, and he would never go to the doctor. I mean, that was just, when he had a heart attack, he didn't go to the hospital. Fortunately, he lived. but that was the belief system that the old folks kind of had, that doctors were not to be trusted. And so we've come a long way in breaking that kind of mythology and grounded fear that really is understandable. The Tuskegee thing, is what it is, and you can't deny it. But, Black folks have had this amazing kind of, tradition in healthcare as well. And so many of the great breakthroughs are from Black doctors. And so healthcare is the opposite of that as well. Black healthcare has been taking care of the Black community since doctors were created. So it's a mixed bag. And that's why the COVID thing is so kind of, it's unfortunate, because this legacy that we're talking about has seeped over into some fears with the vaccines and things like that. And that's really unfortunate, because, from my understanding, you guys probably know more about this than I do. One of the Black doctors created the vaccine, and so that's such a historic, important step forward. And Black doctors are in the middle of all of this, and Black folks have suffered so much from the COVID virus. I mean, I've lost, people in not my family, but I've lost dear friends from it. And I think Black and brown people have suffered horribly from this pandemic, and to not embrace the vaccine is really tragic, because we're losing so many people from the pandemic. And so that whole past that we're talking about, this is why it's good that you're talking about this, because hopefully we can, I think when you understand kind of where this comes from, some of these fears can maybe be put to bed, and we can hopefully move forward.
Kind of as a follow-up to that, and we discussed this when we chatted earlier, you hear about these horrible stories from hospitals. There's King Drew Medical Center in Los Angeles County, lovingly referred to as Killer King before it was shut down. And you have Mercy Hospital in Chicago that has recently declared bankruptcy, leaving this healthcare desert on the South Side. So I guess my question is, how far have we really come in the treatment, the healthcare treatment of Black and brown Americans?
Well, that's the other part of the story, isn't it? That the urban healthcare, and urban healthcare is always short-handed, and it's always understaffed and underpaid and underfinanced and underbudgeted. And that's the story of these hospitals you mentioned. I mean, these hospitals, and it goes hand in hand. When you don't have the money to run them correctly, you also typically have mismanagement. and they kind of go hand in hand. And mismanagement often then creates the problems that we're talking about. And that's one of the great things about Truman, is that Truman has always been this kind of example of an urban hospital, right in the middle of the troubled part of Kansas City. And it is, in the management of it has always been, impeccable. And because of that, it's created this reputation for serving the community in a super positive way. That's not the case with these hospitals you talked about. And these hospitals, the need of the community in these areas is significant, is overwhelming in many ways. And because of all these problems I've just kind of described, these hospitals, fail and then end up failing the community. And this is where the federal government really comes in. This is where I think the way we look at healthcare in the country, that has a lot to do with this. If we had more of a point of view of healthcare as a right, I think some of this, could be improved. I mean, anytime you've got a hospital in a poverty-stricken community, it's an uphill battle. I mean, it's like you're in a war zone, literally, and you've got so many different issues you're not dealing with a hospital that's serving, middle class and upper class people. I mean, it's just simple as that. And so if you don't have the resources to meet the challenges of that, and if you don't have then the leadership and the management to do that, and what happens is that with any institution, good leadership is often given better opportunities elsewhere, and those leaders go to other places, and there's a cycle of good guys coming in, good gals coming in, and then moving on to other places and replaced by people who are less experienced, and so you have these ongoing problems like that. And I think these hospitals you described have all suffered from that. And LA and Chicago and those medical deserts there. I mean, those things, when we made the movie Chirac in Chicago, I learned about how if you had a gunshot wound in certain areas of Chicago, you got to drive long distance to receive care. And it's literally like a war zone. It's like a triage kind of situation. And so, yeah, it's a huge problem. But it's one that I think Truman has always kind of been the example of how to deal with that problem. And I think it's a combination of management and resources.
So I think you kind of answered that question on this one, but along those lines, we talk about healthcare inequities. We talk about infant and maternal death rates, especially here in Missouri. The fact that death rate for a Black child with leukemia is 43% higher than that of a white child. From your perspective, what do you think the steps are to end those inequities? You kind of mentioned it, management, more resources. Anything else you think you might add?
Well, I think a big part of it is again the way we view healthcare in the country. The fact that Obamacare was attacked the way it was. I mean, here this is not anything close to socialized medicine, but here you've got a program, a solution to this ongoing problem of so many people not having insurance in the country. And so, we come up with something that really is as private sector as you can make it when you really get down to it. It has nothing to do with the public sector. It has to do everything with the private sector. This is a capitalistic idea. I mean, having private insurance is capitalism. It's not socialism. And the fact that it was attacked as socialism tells you everything you need to know about kind of the ridiculous mindset that is against people being able to go to the doctor. And that is something that's unique to America. I mean, that's just something that is an American problem. I mean, people, I always tell friends, you go out to Western Kansas and you try to talk to people about things like Obamacare, and you try to explain it to them. And it comes down to, why don't you want to be able to go to the hospital and when you're sick, or when you break your arm? In Canada, when you break your arm, you go to the hospital, they fix you up, and you don't get a bill for $10,000, and the fact that we fight against our own best interests, that we don't believe that we should be able to go to the doctor when you're sick and be taken care of without receiving a huge bill. I mean, it's mind blowing. I mean, other countries think we're crazy. I mean, and all you can say is we're crazy. I mean, it makes no sense. And I think the Black community specifically suffers, the most from all of this, because anytime you're dealing with the issues that Truman deals with, a lower income community, that with all the pressures and all the health issues that go along with that, you've got to fight. You've got a fight on your hands. And the fact that it could be improved if we just thought that healthcare was a right and not a privilege, it just makes no sense.
I want to shift gears just a little bit from talking about racial inequities in healthcare to just plain old racial inequities. And I will say the first film of yours I ever watched was Confederate States of America. I remember watching it in my undergraduate years. And in that film, you depict this alternate historical timeline of what would have happened if the Confederacy would have won the war. So while some of those elements are obviously fictional, I think there might be some that are more closely aligned with our current timeline. I'd love to hear more about your perspective on that.
Well, yeah, I mean, my argument is the South did win the Civil War. And we've, and probably the best example is what we just saw at the January 6th. That was the last assault of the Confederacy on the Union. And we've had this kind of cold Civil War going on ever since the hot Civil War ended in 1865. Civil War never really ended. It goes up and down. It goes hot and cold. Right now, it's kind of warm right now. I mean, what you saw on January 6th never happened in the American Civil War in the 1860s. That never happened. They never got that close. And the fact that, and I think they got inside the Capitol because we don't want to admit what we're talking about right now, that the Civil War never ended. And so the police there, I mean, then they were talking about it today, literally having hearings about it. The police thought that it just couldn't be that bad, but it is that bad. And I would argue that all of this connects back to why we don't have healthcare, because it's this other mindset that controls us. And I call it the Confederate American dream. And the Confederate American dream was most whites in the South did not own slaves. Most of them were just poor whites that trying to get by. They were the people who fought the war. If you owned slaves and you had property, you didn't have to fight. So literally those guys are walking down the road going off to battle, and they're looking over at plantations, and they're saying, one day
I'm going to have me some slaves like Mr. Johnson over there's got slaves. And so they're going off to fight and die for this dream of owning slaves one day. And they die and suffer horribly for this dream of a few wealthy people to have slaves. And I would argue that's kind of the same thing that's going on now. That those people that stormed the Capitol don't understand that there are people kind of controlling their mindset that don't have their best interest in mind. Healthcare, clearly one of the best examples of it. You're fighting against your mother being able to go to the doctor and have a breast exam. You're fighting against your wife being able to have a pap smear. You're fighting against yourself being able to have a prostate exam. You don't want to live longer. I mean, it is amazing, but it makes sense when you put it in a bigger context. That we've been fighting, that America's had this ongoing conflict for a very long time, and it kind of has repercussions in all these different areas of our life. Healthcare is one of the major ones, but it obviously has, it affects us through education. It affects, the private sector, working class. It affects everything. And I think I'm hoping that one of the things that comes out of this horrible event that happened on January 6th is and they're talking about it. I hope that it kind of comes full circle, but that we understand that that this has been an ongoing fight for a long time, and that we have to finally address it in a concrete manner. That's why things like defund the police, those terms are created, because that comes out of frustration with the policeman on George Floyd's neck, and we see this man lynched. And I always remind people, if that had been a dog, if he had been sitting on a dog's neck, someone would have intervened. Because there were all these people standing on the sidelines watching the policeman just sit on this man's neck, and he's begging for his life, and he's calling out for his mother, and he's sitting there, and he's got his hands in his pocket, and he's totally disconnected from the fact that this is a human being. If that had been a dog, and it was yelping and begging for its life, someone would have run in there and knocked that policeman over and got off of that dog's neck. And the reason that somebody didn't do that is because they're afraid of the police. They're that afraid of the police that if they had intervened, the policeman might have killed them too. That tells you everything you need to know about kind of how the work that still needs to be done in terms of race, in terms of our relationship to the police, all of those things. And I think it's all connected to this bigger thing that we're talking about, which is, this ongoing racial conflict that we've never fully addressed.
Well, thinking along, the lines of, as we kind of started with the beginning of the film, the tunnel, and you were talking about how people were taking risks and doing things back and forth, like the humanity of life was showing secretly in this tunnel, right? In my mind, I kind of was thinking through the conversation, Truman now as a building, as an institution, is all the great embodiments of that tunnel. We're giving people an opportunity to learn. We're learning. Everyone's able to be at the table. People are having better experiences. But sometimes we have to tell that story in a way that can make us feel uncomfortable. Many powerful films on Black experience retell, painful events in the history, the unflattering side of American history, if you will. As a filmmaker, what do you hope the audience will take away with them after they see a film highlighting examples of racial inequity in America?
Well, I think to be an American is to be uncomfortable. I think the more you understand about America, the more uncomfortable you are. And I think that's a good thing. I don't think we're supposed to be comfortable. we've not arrived at a place where we can be comfortable. I mean, the George Floyd lynching is probably the best example of that. That you know, every other week there's a new case like that happens, and we're all shocked. It's like Gil Scott-Heron says, "America leads the world in shocks." You know, we're always shocked, right? And because of that, we should have a level of discomfort that allows us to not become complacent. And all of us, Black folks, white folks, everybody, we just want to chill. You know, we want to just say, hey, it's all good. And unfortunately, it's not. And that's everybody. I do it. Everybody does it, right? And so we have to fight against that. And when I make a movie that illustrates the past pain and the past kind of things that people endure, you know, I hope that it's a reminder of today. I hope that it's a reminder of, I think the more you understand the past, the more you understand the present. I think when you don't understand the past, you're not going to understand now. And I mean, you know, it wasn't, you didn't have to be Nostradamus to predict January 6th. It was, everybody saw it coming. And it's like the George Floyd lynching. We all kind of just watched it, knowing it was coming. You can't do what, you know, the other president was doing for so long, feeding that fear, feeding that climate, and then not have an explosion. And so that's the thing that you hope when you make films, and even in the Truman film, you know, included in that, because, you know, even when you make, you know, films about, you know, what you think is just a historical moment that we should all learn from and can grow from, there are people that don't want to go back and talk about that stuff. I mean, we ran into people, Black and white, didn't want to go back there. And that's disappointing, because we need that information. We need to know what happened, you know, and before they're gone, we need to know it. And especially Black history disappears. It disappears, and you don't get the facts quite often. And when those folks are gone, that history is gone. And, you know, so much of our struggle is looking for the information about things that have gone away. And when it existed, no one respected it enough to really, you know, collect the facts about it, to maintain the history of it. And so that's why I do it. I think to me, you know, it's my role as an activist. It's kind of my role as, I think, an American. I think, you know, being an American is being uncomfortable, and more I can make other folks uncomfortable, I think I'm doing my American duty. And it's not about guilt. It's not about guilt at all. I think so many people kind of think that when you tell a difficult story, you're trying to make people feel guilty. You know, it's really the opposite of that. I call it taking ownership of the history. Right now, this uncomfortable, the ugly part of the American story, that history owns us. We don't own it. And as long as it owns us, we're going to be victims of it. And when you own that history and you can talk freely about all the painful episodes of American life without guilt and without anger and without depression and without any of those things that go along with that, when you can do that, America is going to be a much, much better place.
I agree with you, Kevin. As someone who thinks history is significant to everything, the idea of revisionist history that we've created along the way, I think has completely skewed our understanding of ourselves and our past. And it's done us no service. I do want to mention, you were talking a lot about George Floyd. Today is the 1-year anniversary of the murder of Ahmaud Arbery. And I think that's a significant thing too. We can step back from the police and just talk about just the treatment of Black individuals by the dominant culture in general.
Yeah, I mean, and those incidents have happened, thousands and thousands of those incidents in our history, right? And it's so hard to, you know, Emmett Till probably is the best example of that, you know, of a young person who's just dies for nothing. And the fact that Black life is lost that way on such an arbitrary, kind of nonsensical kind of level all the time, that's part of the hard work that we've got ahead of us. And those stories are hard to listen to. They're really hard to listen to because they're so tragic, and so often it involves young people. And but that's also why we've got to breathe those stories in and then come back with things that hopefully make things better, so these don't happen as frequently.
I don't have any other questions. I think we exhausted kind of the list that we were discussing. I think it's first, thank you very much for taking the time to meet with us. I've watched From Separate to Equals several times, and I really I learned something new every time, honestly. But I'm wondering if anybody else that's watching, you know, it'd be a great time to kind of think if anyone has any questions, any thoughts.
I have a question from Gerard Grimaldi, who's our Vice President of Government Relations Policy. He's sticking on the history track here, and he would like to know your perspective on Executive Order 9981 and how desegregating the armed forces was a catalyst for the civil rights movement.
Yeah, that's a big one. You know, my movie, The 24th, is about the Houston riot of 1917. And one of the arguments that they used against integrating the military was the Houston riot. And I mean, the Houston riot was, for those who've not seen that movie, it's called The 24th. Plays on Stars right now. It's playing today, actually, on Stars. You know, it's another one of those buried pieces of our history that I came across a story in a book called The Black West that had this photograph of 63 Black soldiers on trial together, you know, guarded by all these white soldiers. And it said the largest murder trial in American history. And it's like, I don't know anything about this. And no one knew anything about it. All my teachers, nobody knew anything about it. And I had there was one book literally on the incident. And so that photograph really spoke to me. And it took me about almost 20 years to get that movie made. And that part of our history is, I mean, Hollywood doesn't want to, they don't run down the street to tell those stories. I mean, those stories are hard to get made. But I think they're important. I think they're really important because that's now a document that will outlive me and that will always be there so that young people, future generation can learn from that film. You know, I was in a riot in high school, and Dr. King talks about a riot is the language of the unheard. And when you're in a riot and you see kind of how people break and how people get so fed up that they just break. And that's what happened in the Houston riot. And that's what happens quite often in riots. People just kind of get to this point where they break and once people break, there's no logical, emotional kind of, you know, once you've got to keep them from getting to that point. And So that to me is really significant, because obviously the integrating the Army, integrating the military with Truman, President Truman, it moved us. It totally moved everything forward, and you know, the fact that Truman did it, you know, we should be very proud of that. And Truman did the first civil rights kind of act and bill. And Truman, you know, Truman's got it. I think he got it because he liked to hang out on 18th and Vine, and he liked Julia Lee, the singer, and he would go down there on 18th and Vine and hang out and listen to those guys, and he knew Black people personally, and that's the stuff that breaks down those barriers, and that was the same thing with Eleanor Roosevelt, and you know, so that's a real feather in our cap in terms of you know, how Kansas City kind of had a really, you know, significant part of probably why that order was put forward.
Russell, anything else in the chat for questions for Kevin?
No, I haven't seen anything. Jake?
I'm curious if you will ever do a film about Black Wall Street in Tulsa.
You know, that's been on my list for a long time. And, you know, unfortunately, I you know, somebody will make that film at some point. I'd love to make it. There was a guy, that's the story I've heard from, you know, in the business circles, is that there was a guy that had a book and he kind of poisoned a well, you know, a little bit about it. He kind of went all over the studios and has turned a lot of people off of the story. So that's, I've not heard about anybody making that film yet, but it's obviously it's that period of our history again that we don't know nearly enough about. You know, there was this show Watchmen, yes, and it had that, and you know, it showed the Tulsa riot there in it, and people were all surprised that they didn't know anything about it, and that's what we're talking about. It's like that uncomfortable part of our history can't be a secret. You know, I mean, you know, there are people that don't understand why Black people and others are fighting for the things they're fighting for now, and we're fighting for those things because of things that happened 100 years ago. And those things that happened 100 years ago are still affecting us today in various ways. And you know, you've got to be able to tie all of that together. And the more you tie it together, the more you understand today. And so, you know, that was just another great example of why, you know, we need to tell these stories.
I agree. Russell, do you have any final questions for Kevin?
I don't, and I haven't seen anything pop up in the chat.
Kevin, is there anything you want to ask us about what we're doing at Truman, or, you know, what our goals and objectives are from a DEI Council perspective?
Yeah, I mean, you know, I mean, again, I was so impressed with Truman to make the film, and you know, the fact that Truman kind of is a true kind of community hospital, which, you know, like we talked about, that's not an easy thing, and the fact that Truman's been successful is really unique, because, you know, these examples you gave of other cities and how these hospitals have died, and there were a lot more Trumans that existed 20 years ago and 30 years ago, and they're all gone now. And so tell me a little bit about what you guys are doing these days.
Russell, do you want to start talking about the new ED&I department? And then we do have a couple questions for you in the chat now.
Yeah. So Truman recently formed a department. We've had a chief D&I officer for the past several years. Due to our size and trying to increase our scope of the work, a department was created. There's 3 of us. We're all on this call. And so part of the work is helping individuals kind of think about not, the biases that we have and the values that we associate with things, consciously and subconsciously, and trying to help individuals communicate more effectively within our organization. We're vast. We cover a lot of area. Got night shift, day shift. And so how do we as a group work cohesively and understand each other in the same time? And on the council, really trying to provide support to our staff through many different questions around the ED&I, things like career advancement, identity, if you're part of the LGBT community, or if you're a Black individual or a woman in the workplace, providing resources to them to help them achieve the things that they want to do. So those are the things that we're looking forward to doing, and Maria's providing us awesome leadership on that. We do have a question that came through while we were kind of talking. I don't want to miss it. Came from Ume Abbas, and what was asked was, what are your thoughts about homelessness, mental health disorders, and substance use among Black Kansas City, and any ideas on addressing these?
Well, I think it's a national crisis. It's been a national crisis for a long time. I worked with homeless, created a couple of shelters in my hometown of Junction City many years ago. And the fact that, the term homelessness, that just should not exist. That should just not be a thing. And the fact that, I think it goes back to people not being treated for health issues. It's kind of the same thing, if you've got a medical issue and you're not being treated for it, if you're homeless and you don't have a place to stay, that's basic services. Those are human rights, I would argue. And that's other countries don't have this problem. That's the kind of thing it always comes back down to. Other countries have systems designed to address these things. And the fact that we kind of have this rugged individualist kind of thing that we believe in, coupled with the fact that mental illness is just so under resourced and unaddressed in the country. And you see it all the time. I see it with my students. I see it. It's a constant problem, and all of those things end up creating homelessness. And it just, we have to want to rid ourselves of this. And as a nation, we have not decided to do that. Until we say, we want everybody vaccinated so no one gets measles anymore. And we want to, we get rid of the things that we seem to want to get rid of. And these are homelessness and is one of those things we decided not to address that way.
So I have a question, and I wish I would have thought of this one. If you have seen Judas and the Black Messiah yet, and if you have, what your thoughts are on it, and if you haven't, what you're hoping to see from it.
Well, yeah, Cointelpro and the destruction of the Black Panthers and all of that was just one of the most underhanded things that existed in the country in the 60s and the 70s. More than likely that they were involved in Dr. King's assassination in some kind of way. It just lets you know that there are a lot of reasons why things have not progressed in so many ways. Because people that try to move things forward in various ways, a lot of them were killed, a lot of them were assassinated, a lot of them were undercut,
and they didn't understand why these things didn't succeed, but there were forces, you know, unknown to them that were trying to sabotage. And that story is a great story, but that happened, you know, 100 times, you know, during that period of probably from J. Edgar Hoover's assault on the Black community from, you know, 63 to, you know, the 1970s.
All right, Russell.
Looking through the chat, we did have one of our coworkers. He just wanted to extend his share a sincere appreciation for the outstanding presentation and for you taking the time to meet with us today. To listen to you was educational and motivating. It was very interesting to hear about your experience and fascinating insight, and you enjoyed the time, and you enjoyed the clip that we showed. And so just a sincere thank you for one of our nurses and one of the members of the ED&I committee.
Thank you.
We did have one that popped in from one of our staff. How do we start the conversation when this country is so divided right now, with 2024 looming down, and former President Donald Trump will make another run at the office potentially, and all the support he still has amongst Americans? You know, how do we start? How do we acknowledge this past that, you know, we kind of alluded to earlier?
Well, I think we need all the facts, which is why the thing that's happening today is good, that we're starting. There's a lot of facts that we haven't even gotten out of the January 6th event, back on the democracy, really, and attempted coup. And all of that, it says so much about the distance that we still have to go. But, you know, the good news is that we survived the coup. A lot of countries don't survive the coup when it happens. So we survived the coup, which says a lot about us. But I think the big problem right now, one of the reasons we're so divided, is the use of misinformation. And there's so much misinformation out there right now that is literally kind of brainwashing people. And the QAnon thing is the best example of it. That you've got people out there that you know, believe this crazy notion of, you know, I don't even acknowledge what they believe, but that all came out of Donald Trump. And the fact that it came out of an American president, we have to acknowledge the devastation that he inflicted on the country. And but it is part of that thing I was describing about the Confederacy. And he kind of leveraged the Confederacy to his advantage. And hate groups have risen during that period. Our movie Blackkklansman, you know, it reflects that. I'm really glad that we were able to make that statement about his involvement in that. And that's been coming around for a long time. When I was president of the student body in 1982, I received it was a form letter. It was from David Duke, and he had an organization at that time called the NAAWP, the National Association for the Advancement of White People. And he was wanting to speak on college campuses. And at that time, he was trying to make that transition to from Klansman to legitimate kind of political politician, to a political leader. And I would argue that he did make that transition through the form of Donald Trump. And the fact that he was at Charlottesville and that fact that Donald Trump justified it with his statement about there are good people on both sides. I've never personally ever met a good Nazi or a good Klansman. but the fact that that will go down in history now as this reflection on people who felt encouraged by all of that. And the good news is that it's all kind of exposed right now. January 6th, all the roaches kind of crevices of the ghetto. And we've all seen it. We know they're all there now. Now the question is, what are you going to do about it? And there's a lot of them, and they feel really empowered right now and emboldened. And we've got a big job ahead of us. And people don't understand this. They don't understand that this doesn't just affect this really.
Sorry, kind of cutting out. I don't know if might be internet connection. Camera, is he frozen on your end?
Yeah.
Okay. Yeah. Oh, sorry. Can you hear us now? You're kind of coming in, cutting in. I don't know if your internet is telling you poor connection.
That the fact that we the whole been exposed now that we have and
Hey, Kevin, I don't know if you can tell, you're cutting in and out for us.
I'm seeing you guys, but
okay. Yeah, no. There's probably a good solid 30 seconds that you've been talking and we can't hear anything. So
no, nothing there.
I didn't mean to cut you off or anything like that. We did have one more question that came through that I think it's a good kind of pivot. How do you feel we can stop perpetuating the engraved slave mentality to our younger generation? Or do you feel it's necessary to remember our history? 1619, that's a big, that kind of discussion among the African American community. What are your thoughts?
Yeah, I think as I mentioned, I think the more you understand about the past, I think that kind of wipes out that slave mentality. I think it can't be a thing of, it should empower you, but you've got to be willing to kind of also step outside of your comfort zone to move things forward in the outside world. And what I mean by that is, I think a lot of times I run into Black students who, get tired of educating white people. They complain about it. They complain about all the dumb questions that they get from their white friends. And I think most Black people that have been in an educational setting have had to deal with that. And it is unfortunate that you have to kind of do that. But that's especially when you live in the rural kind of part of the country, where a lot of times the whites that you're going to encounter at school have not been exposed to African Americans or Latinos or Asian Americans. And this is often their only opportunity to kind of learn from you. And as uncomfortable and awkward and weird as it is at times, I think we have to do our part to educate those folks.
I agree. I think that's a great question. I feel like that's something that we probably all have encountered at some point, especially recently, when you start to ask questions about anti-racism and all these things. And it can become it's exhausting.
Yes, it is. But unfortunately, if you don't kind of give that person the answer in that moment, they're not going to get an answer. And oftentimes they're going to stop asking the question, which is where QAnon gets to fill in that hole. The crazies get to fill in that hole. And that's kind of why we're so divided.
Different narratives when you don't step up. I think one person was asking, do you have a few books that you would recommend us to read to continue kind of the education and conversation on the topic today around General Hospital Number 2 or any of the information around healthcare in Kansas City?
There's a book about I believe it's called medical apartheid that I think is pretty good. You know, unfortunately, I think that the resources in this area, specifically with healthcare, are a little limited about segregated healthcare. I think we need more of those books, especially books like that deal with places like General Number 2 and those hospitals that you mentioned, Kamara, that you know, that in those big city hospitals that were like General Number 2, that most of them are no longer around. The history of those hospitals and kind of what they meant to those communities, you know, that's really an important story, and that's one of the reasons I'm so glad that we made our documentary, because you know that a lot of those folks are gone now, and a lot of those stories left with them, and we need that history, we need that information.
Kevin, as someone who's had the honor to meet some of the Black nurses from General Hospital 2, I'm sure they would be giddy over this. And I just want to thank you for helping us to continue to tell their story, because you're right, they are, their numbers are dwindling, but I think through the documentary, I think their story can live on. So I truly do appreciate what you did with that.
Oh, thank you. Yeah, I mean, they're you know, when you hear their stories, they were all true heroes, and I hope to do more about them at some point.
I think that's all that we have today. Once again, thank you very much. It's always an honor to learn from somebody who just delves into these topics.
Oh no, this has been great, guys.
And Kevin, before we let you go, is there anything you have coming up that you want to share with the group?
No, probably my film, the 24th. Kind of look for that. It's on Stars. You can get it on Amazon Prime. Let's see. I've just been doing just a lot of writing, so it'll be a little bit before I get a new one coming out. So I wrote one on Arthur Ashe, the great tennis player. So I hope that movie gets made. So we'll hope to see you guys soon with a new project.
Wonderful. Well, thank you so much for being here today. We truly do appreciate you and taking the time to have this conversation with us.
By all means, thank you. Appreciate it.
All right. Well, you have a good day.
You too now. Bye-bye.
Okay, everybody. Thank you very much.